bring an MRI machine to the Regional Cardiac Care Center here at St. Mary's, and Manulife is matching dollar for dollar, as mentioned, throughout the day, up to $200,000 in donations as well, to bring that MRI machine here. And we continue the show at St. Mary's General Hospital with Jordan and Jason, who are here with us, as well as Dr. Warren, the medical director of the cardiac program. So, Jason, I guess we'll start with you. What's the story about what you can tell us about what you've been through?
Yeah, so Jordan was experiencing a lot of discomfort in her chest. We thought she had something called costochondritis, which she had several years ago, which is an inflammation of the ribs, like a virus in there. So we were treating it with Advil. She was very weak. She was uncomfortable. That started on a Thursday. Sunday, she was still feeling terrible. So we talked about taking her to the doctor on Monday. And I went to work for the first day after COVID, and basically I got a phone call 40 minutes into my workday saying she needed to go to the hospital. So I immediately left work, picked her up and took her to Grand River. We were in triage where Jordan fainted. They immediately took her into the ER, did a CT scan of her lungs, determined she had multiple clots in her lungs, and they performed a clot buster called TPA and put her into cardiac arrest. They revived her after about 4 minutes. They got on the phone to St. Mary's to determine if they had the capability to put her on an ECMO machine, and they found room in their schedule to get her in, and they got her in within an hour to start the procedure. So that's kind of where we started. It happened really fast, and we're just so thankful that both hospitals were able to perform life-performing procedures on her.
How scary was that? I mean, that sounds like a story that nobody wants to experience, obviously, right?
Yeah, it happened so fast. Like, they basically took me, like with COVID, though, I wasn't even going to be allowed into the ER, but I was allowed in there because Jordan was going to faint. I messaged my wife when she was at work and I said, don't bother coming, because she wasn't going to be allowed in. And a couple minutes later, after things went downhill very fast there, they said, call your wife. And so I messaged her to see if she was able to come. I messaged her, then I phoned her. I said, just come to the ER immediately, somebody's waiting for you. So yeah, it was a life situation that she was in, and we're just so thankful that everybody did what they needed to do, and the team at Grand River was able to save her life.
And Jordan, for you, obviously having your life saved because of the Cardiac Care Center here, what does it mean to you about the work that they do here at St. Mary's General Hospital, knowing that you've been someone who's been cared for at this hospital?
It means everything. You can't put it into words. This team, this hospital literally saved my life. There's not much more you can say than that.
And for you, when obviously you were going through what you were going through, and going through that experience and sharing your story now about what you've been through, how do you think that story can help others who might not know about this cardiac care center here, or might not know what the work is being done here within this hospital?
Yeah, I think that it just goes to show how serious these things can be, even if you don't know it. And that I wasn't aware that St. Mary's was a cardiac center until now. So I feel like that's really good information to know, just to be aware of, because these things happen so fast. Yeah.
Yeah, and if we would have known maybe a little bit better that we should have come to meet St. Mary's first because of her condition, that would have saved an ambulance trip and maybe a little bit of time as well.
Yeah.
Dr. Warren, when it comes to an ECMO procedure, can you give us a little bit of background on what that's all about and how critical that is to helping someone like Jordan?
Right. So ECMO stands for extracorporeal membrane oxygenation, which is a big mouthful. But extracorporeal, basically just Latin for outside the body. So what it does is it's a machine that shunts or pumps the blood outside of the body so it can pick up oxygen and then bring it back to the organs that need it. So we use this in times when when the heart and lung are either damaged or under such duress or stress that they can't meet those needs of the body. So one of the more common reasons for using it outside of cardiac issues would be things like very large blood clots to the lungs, like what Jordan suffered from. And we also use it for many other reasons. We've used it a lot during COVID because, of course, when the lungs are so damaged that they can no longer efficiently exchange oxygen, we have to go to external means to do that. We also use it in people with cardiogenic shock after large heart attacks or people who are awaiting cardiac transplantation. Essentially, though, the easiest way to think of it is the heart-lung machine. It's a type of that in layman's terms. But it's the way we look at it from a practitioner's perspective is it's something that buys us valuable time. It allows us to treat the underlying cause or to allow organs to heal enough that they can pick up that job again on their own. But without buying that time, unfortunately, a lot of patients don't make it. So we're very happy to be able to provide that service here. Now, it is a very resource-draining service that we provide, as Jordan found out. So at St. Mary's, we have the capability to initiate ECMO. But because it is something that is rarely performed outside of COVID times, we do somewhere in the vicinity of about 5 to 8 per year, sometimes closer to 10. So it's not something that you can have a team on call for 24/7. So we do have the expertise to initiate it, but then within 24 hours, those patients have to be transferred out because the ECMO management, once it's been initiated, is done on a regional level. So we generally transfer patients to either McMaster Health Sciences Centre or Toronto General, and then they'll stay there until they're off ECMO, and then they come back to us for their further care.
How critical was an ECMO procedure for Jordan's situation? Was it something that if it wasn't here, that it would have been a different outcome?
If it wasn't here, she wouldn't be here. It's that critical. That critical,
yeah. And Jordan, for you, when it comes to how life is now, after what you went through, how is life now?
It's good. I'm back on my feet. I'm doing my thing. I'm working a job. I'm doing so much better. Yeah.
And for your family too. I mean, how is it to see Jordan doing what she's doing now after everything that she's been through?
Yeah, the recovery has been exciting to watch. Every day we celebrated little wins, whether it was turning down the sweep on an ECMO machine, where her body was able to take on more of the work, whether getting the breathing tubes out. Every day we celebrated something, and we tried to stay positive the whole time. She stayed at Toronto General a little bit longer, and she was able to make a really good recovery there, and she did a victory lap of the MSICU, which not too many people get to do over there. And since she's been home, we've been kind of staying with her. Hopefully at some point we'll feel confident just leaving her on her own, but right now one of us is working from home and we're helping her recover, and she's getting stronger every day, and we're making all the foods that she loves to eat to keep her body strong.
When it comes to the progress that you have seen since she's been out of hospital and back home, and everything that the recovery comes with, what's the biggest thing that you've seen in Jordan that has improved since she's been out of hospital?
Her spirit's really high. She's really optimistic. She's got a sparkle in her eye again, which was gone for many weeks. Like, it's just amazing how she's bounced back. She's young, she's strong, and I think that's really helped. Typically, these procedures are done on people that are much older than a 21-year-old girl, and her body's been responding really well to all the treatment. Her wounds are healing nicely from ECMO, and we're hoping that she can continue to enjoy life and start swimming in a pool and keeping on exercising and making a difference.
Jordan, you mentioned that you're working a job and you're trying to get back to what you would do everyday life. How important is it for you to make those steps and be able to do some of those things that you weren't able to do early in your recovery?
It means a lot. Being able to get back to some sort of normalcy makes me feel like I'm getting better. like my dad said, it helps my spirit. It feels like I'm okay and everything's going to be okay, even though I know that things are going to be different. I'm on blood thinners and it changes some aspects of my life, but having things return to how they were makes everything feel okay.
And Dr. Warren, for you to see the progress that Jordan has made since her recovery and since she's been in hospital, for you as a doctor, how important is it for you to see someone to have a success story like this?
Oh, it's fantastic. You can, if you spend too much time looking after just the critically ill, sometimes you lose sight of how they look at the other end. And that's been a challenge during COVID. It's been, draining to see so many people suffer. But when you see people like Jordan come out the other end of that treatment and being so critically ill, and now to see her as like this vibrant young woman who's getting back to normal, and I mean, albeit a new normal, with a bit of a change to lifestyle, but it makes it all worthwhile, and it makes the burnout that healthcare workers are suffering so much easier to bear when you see these happy stories. And that's really why we're here.
Back to Dad, if I can. When it comes to, you mentioning that had you known that St. Mary's was a cardiac care center before, how important is it for you to now share your story and be able to tell people the success that Jordan has had with the treatment that she's had here?
Realizing that St. Mary's it's cardiac care specialists. Whenever you feel faint, whenever you're having pains in your chest, like this is the first place you should come to, versus maybe seeing your doctor. Like Jordan had some symptoms on Saturday night where she fainted, which was unusual, and we wish we would have acted sooner. So when things aren't normal, you should go to the ER just to be checked out. For instance, I've been wearing a smartwatch to monitor my oxygen. If Jordan was wearing one of those, we would have seen that her oxygen wasn't 95%. It was 60% when she was admitted into the hospital. So there's things that we can do to kind of keep on top of our health, and there's signs out there that we should all adhere to.
Well, thank you so much to the family for sharing the story, and Jordan for sharing your story as well. I appreciate you doing that, because I think it's important to know that there is success stories when it comes to treatment here at St. Mary's as well. So thank you for joining us, and Dr. Warren, thanks again for providing the background on the ECMO procedure.
My pleasure.
Thanks for having us.
Thank you so much.
Thank you.
We'll be back.